everyone. So I want to continue talking about breastfeeding and infections. For the first 6 months when I started breastfeeding, I had about 4 to 5 infections. I think from where I can remember, 3 were infection in my milk ducts, and then 2 of them were nipple infections. It's where your nipples, the little holes where the milk is coming out, would grow over, and then when he was sucking on it, like a bubble would form. So all of those infections had to be treated with antibiotics. And while taking the antibiotics, I was still breastfeeding, still nursing, even though a lot of professionals say you cannot breastfeed while you take antibiotics, or the milk will, you will stop producing milk because of antibiotics. Did it happen? It's not true. You can still nurse while on antibiotics. Don't be afraid of that. So now to help you ease the infections. Infections happen because, of the milk ducts, because you're producing a lot of milk where your baby doesn't eat all of it. Okay, so what happens? It's a residual milk that stays in your milk ducts, and it forms as an infection. So first sign of infections in your breast will be probably a little bit of red skin, which I never had, but I had a little lumps in my breast. I would notice lumps, and they were like it would hurt to the touch, and they were very tender. My breast would be tender. So on the first sign of that, if you're exclusively breastfeeding, let your baby suck it out. I mean, if you have to put your baby on the breast for an hour, do so, okay? Because your baby's suck is so powerful, unlike anything. Not even a pump will do that, do its justice. So your baby will suck it out. Actually, the residual milk in your milk duct that it's way in there, your baby will suck it out, and you will be left with no infection and no need for antibiotics. If your baby doesn't want to suck that much milk, if the baby don't want to, nurse for this long, get a breast pump. You should have a breast pump sitting in your closet somewhere, just in case of emergency. So get the breast pump, put it on, and while massaging your breast, pump it. Massaging your breast, massaging it, the motion where you want to extract the milk, for an hour, it should work. You should be able to get it out. If it's like really big lump and you think it's really out there, go take a warm shower, like really warm shower, and while you're under the shower, massage your breast, massage it, or take a little towel while under the shower, so the towel will be soaking in hot water. Put the towel on your breast, for maybe 2 minutes, and then massage it with like extraction motion. What I would do in situations like this, I would take a shower and have the pump in the bathroom. So immediately after I got out, I would put the pump on that breast and would suck it out, because the breast was warm and it was just massaged, and everything was just coming out very smoothly. So this you do on the first sign of infection. If it's too late, if all those things don't work, immediately grab a phone and call your doctor and make an appointment. Sometimes your doctor might prescribe you antibiotics even without you going to the office, but usually they want to see you because they want to see if the infection is the infection we're talking about. If it's not anything worse, if it's not a lump or anything like that. But usually it's fine when you take antibiotics. It just goes away. like I said, this all happens because you have a lot of milk, a lot of, you know, a lot of girls that I speak to, you know, when we talk about breastfeeding, they say that, you know, I say, why didn't you, you know, why didn't you breastfeed? And they would say, oh, I tried for 2 weeks and I had no milk. And I said, oh, really? And they keep going, yeah, you know, I had a lump. I had this horrible, horrible lumps in my breast. I had no milk and I had to stop. No, you know, these girls don't know what they're talking about. They had too much milk. That's why they had the infection, and they didn't put the baby to the breast enough. They didn't pump enough. That's why they had the infections in the breast, the lumps, they call it. It's not why, you know, it's not because there was not enough milk. It's a myth. I would say 80% girls that I speak to that started breastfeeding and didn't, you know, proceed. I would say after 2 weeks, they all say that they didn't have, you know, they had low milk supply, and all of them had lumps in their breast. So all of them are wrong. Okay, keep doing it. Don't stop. Like I said, it's gonna hurt you, you know, a little bit. Take a painkiller. You can take Advil. You can take Tylenol. If it hurts a lot, help yourself with those, and it will pass. You know, either, you know, extracting the milk will help you, or the antibiotics will help you. Just don't stop. Don't stop. This is the worst thing you can do to your breast, because if you just stop, you know, just one day just stop breastfeeding, your breast will get huge like this, you know, like they're gonna feel like they're gonna explode, and then you're gonna have a big problem on your hands, because that milk, you know, that kept on producing, and your, you know, your breast keep on producing because, you know, you just gave birth, so they keep producing milk, and you just stop. You cannot do that. If you're breastfeeding for a little bit, you know, and you had a breast infection, and you want to stop, you have to stop gradually. You cannot just stop one day, because your breast will explode, or they will feel like they're gonna explode, and you're gonna need a lot of medications for that. So if you want to stop, you have to, you know, nurse a little bit less and less. It's a gradual thing. You cannot just stop one day. Please don't do that, because you're gonna hurt yourself. If you want to stop immediately because of something, infection, it's really hurting, you go to your doctor and you tell them you want to stop breastfeeding right now. They might give you a special medication for that, so your body will stop producing milk. Okay, this is the way to go. So this was a video about breast infections due to nursing, which is really normal. It's nothing special. It happens to every woman that I know. You know, even I have a friend who, she never had problems breastfeeding, never, and then yet one day she said she noticed a red spot on her breast and a lump, you know, and she did what I said. She put her baby on her breast and she nursed them until she, you know, she stopped feeling the lump. So it happens to everyone. Don't be afraid. Call your doctor. Take care of it. Take care of your boobies. And like I said, don't stop, and don't let nobody tell you that you need to stop. Okay? Good luck. Don't be afraid. Take a painkiller and it's gonna be fine. Bye.